Hello everyone, myself Vivek Devani and my topic is insulin coma therapy.
Insulin coma therapy, also known as ICT, and it's also known as insulin shock therapy. It was first introduced by Manfred Sakel, and it is mostly used in 1940s and 1950s to mostly treat the schizophrenia patient. It was also used to treat other disease, other mental disorders, but mostly used to treat schizophrenia. Now, first, what is insulin coma therapy? So, insulin coma therapy is it's nothing but inducing a controlled coma in a patient by administering large amount of insulin to the patient. Okay, and however, it is not used now much a days because it has many high risk and there are many other alternatives fine of ICT. The ICT, when it was first introduced, where it was mostly used in Austria and then it traveled to other countries such as United States. Now let's discuss the procedure of the ICD. ICD was a labor-intensive treatment, which means it needs a highly trained staff and a specialized unit to continue the procedure. There were no specified protocols or guidelines were given for the ICD treatment. The procedure of ICD was divided into 6 different steps, which were followed one after the another. The first step is the patient selection, in which the patients were selected for the treatment of the ICD. They were mostly of the psychiatric disorders, but mostly of them were of schizophrenia. Other patients which were selected are those which were not showing any kind of response to other treatments. The second stage is of fasting. The patients which were selected need to fast overnight just to minimize the risk of aspiration. It means that vomiting can lead at the time of induced coma. The third stage is insulin administration. In this, the patients which were selected were administered with a high level of regular or fast-acting insulin, which may lead to drop in blood sugar level of the patient and which may lead to coma-like state of the patient. The fourth stage is of coma induction, which means as the blood sugar level of the patient decreases, the patient will lose his consciousness and lead to unconsciousness, which means he or she will goes to coma. The coma duration depends on the amount of insulin is injected in the patient. The fifth stage is of monitoring and care. As it is a highly risky therapy, so continuously monitoring by the medical professionals should be needed. Vital signs such as blood pressure, heart rate and blood sugar level should be checked for the patient's safety. The sixth and the final stage is awakening. As the desired duration of the coma is achieved, then the patient should be awakened by administrating glucose or carbohydrate solutions, which may help to increase the blood sugar level of the patient, and it may help to awaken the patient. There are some special points which should be taken care of during the treatment. So the points are: patient should be placed in a semi-dark room. Eye shield should be provided to the patient for the purpose of relaxation. As the patient enters in the coma stage, eye shield should be removed. In some patients, you will be able to see some active reflexes are present during the coma stage. In some patients, you will also able to see the hypoglycemia symptoms such as early restlessness and many more. In the stage of in the awakening phase, you will able to see tremors and seizures in the patients, and in some cases patient may also bite their own tongue, and to avoid that we should provide any type of clothing or gauze between the patient's teeth, so the biting of the tongue should be avoided. And secondly, we should turn the patient's head in one or the either direction. So now let's discuss some of the effects of ICD. the effects are symptoms improvement, which means that some psychiatrists and which including claim that ICD leads to reduction in the symptoms of many mental disorders, mainly schizophrenia. The patients were reported to claim that they feel calm behavior, increased mood, and decrease in delusions and hallucinations in some cases. The second effect is risk in complications. The inducing hypoglycemic coma has a very high amount of risk. So, to maintain the blood sugar level during the ICD was very challenging, right? So that's why many cases has been reported of brain damage and even death during the ICD treatment. The third effect is memory loss. The memory loss leads in many cases in many patients, but it is of temporary basis. But in some cases it may prolong or become permanent. So now let's see the symptoms and side effects. Most patients experiences the symptoms of hyperglycemia such as flushing, restlessness, sweating, and salivation. Many patients will undergo seizures or tremors while ongoing coma or after the coma. The most severe risk factor is patients. Some of the patients may lead to death or brain damage, which may lead because of irreversible or prolonged coma. So at last, now let's discuss why there is a decline to ICD. So at that time, the psychiatrists were having lack of scientific evidence that this therapy is helpful. The other reasons is ethical concerns. Many questions were raised against the ICD, but at that time the psychiatrists and other individuals were unable to answer the questions with a valid evidence. The other reasons is that there were many alternative techniques or treatments were found against ICD which were having very minimal risk factors than ICD. And there is one more reason is that there were lack of standardized protocol to giving the ICD treatment. Thus, ICD was declined at that time and it is not used nowadays.
Thank you all for listening me.